prone knee flexion stretch with hamstring isometrics. So we do this a lot with post-surgical patients, someone that has a cranky knee, just trying to restore normal joint motion, but also trying to target our hamstring muscle being contracting in a really shortened position. So if I'm prone around my stomach, my hip is extended or in neutral, and then my knee's being bent to a really short position, and it's really hard to be able to actively engage the hamstrings and use it efficiently. So if you don't have a stretching strap, which most places don't, a stretching strap is one of those nylon looking straps that's got a bunch of loops on it. You can put your foot into the loop and use that. You can take a bigger style resistance band, and what I like to do is I step into it and then I close it on my leg and then step back out. So it's essentially looped through my leg. That makes it a lot easier when you go onto your stomach to get your setup in the right position without having to grab the band, having the band fall down your ankle. And then what you're gonna do is go onto your stomach and you're gonna pull the band up and over your shoulder. So in this position, what I'm trying to do is keep my hip down into the floor, and I'm trying to keep my knee in line with my hip. So a lot of times people's knees will drift out like that and their foot will come to the inside. So I wanna keep my knee in a straight line. And then I'm just using both hands, if I can get a hold of the band here, to pull in knee flexion. And I'll typically hold that for around 10 seconds. And then when I go to let off the band, I'm thinking about keeping my foot in the exact same spot and not letting my foot drift away from my body. And I have to really contract my hamstring in order to do that. And I'll hold that for 5 to 10 seconds. And then what I can do is I can add some tibial rotation to it as well. So if I rotate my foot in, and then I pull into a stretch, if I rotate my foot out, and then I pull into a stretch, let off, try to hold in that hamstring contracted and very shortened position for 5 seconds as well. So a really common compensation pattern is you'll see people really arch to their back. And then when they arch to their back, they're allowing the hamstring at the hip to kind of take over. So you should be able to pull with that strap to create a really good flexion stretch in the knee. You may feel it in the front of the thigh, up into the front of the hip. But when you let off and do that isometric contraction, you should certainly feel it into your hamstring. If you get really crampy, the hamstring contraction is too intense, let your foot move away from your butt so it's not in as shortened of a position. And then do the isometrics in that position and then gradually work on progressing toward pulling your heel toward your butt.